You're live.
Hello, this is Bill, the knee pain guru, the best in the world at eliminating knee pain without drugs, shots, or surgery. Welcome to the Knees for Life Inner Circle Google Hangout. We have this hangout every couple of weeks, and where we cover questions from the members of the Inner Circle, and we also get into specific topics that we're going to address around knee pain. The topic we're going to cover today is I don't need knee surgery, but my knee still hurts. It's a question I commonly get from people straight off the internet. They're frustrated. They go to their doctor. Their doctor says, yes, we've done an x-ray, a CT scan, an MRI, and everything's fine. Your knee looks perfectly healthy. We don't have a reason why your knee hurts, though. And that usually leads into a pain management type of scenario that involve prescription drugs, pain-killing shots, and possibly exploratory surgery as a way of trying to figure out why the knee hurts. Well, it's actually much simpler than that, and it's much simpler than going through a surgery to alleviate this pain. And today we're going to go deeper on that topic. As far as what is actually going on in your knee when you do have knee pain and there is nothing broken or torn, aka nothing's wrong. We're also going to cover why this pain, if you leave it unchecked, will lead to more problems down the road with your knees as well as in the rest of your body, and could even end up in a knee replacement surgery, no matter what your age. This is very important. This is, we're going over a lifetime, what's happening. And if you have this chronic knee pain for a long enough period of time, you will be having that conversation with your doctor about being a perfect candidate for a knee replacement. And then the last point we're going to cover is how you can begin understanding the pain you're feeling and use it to your advantage to eliminate your knee pain. Big piece on that. We want to reframe pain. We want to understand pain deeper. We want to understand pain on a deeper level. And this is going to be extremely valuable to you and your family and your loved ones, those people around you that care, especially when you're in a bad mood because you have knee pain. So we're going to get into all of that on the call today. Neil, is there anything else we're going to be getting into today? We got some questions, don't we?
Yeah, we've got a couple questions from our Knees for Life Inner Circle members, as well as some that have come through our customer service line and I believe YouTube channel as well.
Nice, nice. I know I saw a question from D in there that we're going to get to in just a moment here, but first I want to get into the topic of today. I don't need knee surgery, but my knee still hurts. So the first part of the topic, what is actually going on in your knee when you have pain and there's nothing broken or torn? It's a very interesting point because we have to make a distinction in the body when between something being broken or torn and something just hurting. And if something is broken or torn, there's something wrong. Meniscus is torn, cartilage is wearing, a ligament is torn, something is broken in the knee. And when that happens, you have a part of the equation that we don't have a solid foundation to work from. Meaning, that's where I believe medical intervention is very helpful. This is, you go to your doctor and you get a diagnosis. I've torn my meniscus. I've torn my ligament in my knee. Something's going on where you may or may not require surgery to fix what's going on. And in that case, the source of your pain is because something has been torn. Now, the tricky part comes in is when you feel pain and nothing is broken or torn. So the only thing we're dealing with, and when the doctor says there's nothing wrong, they're actually correct. They aren't saying anything that is incorrect. There is nothing wrong with your knee when nothing is broken or torn. However, here's the piece that you don't see on an X-ray, a CT scan, or an MRI. What you're not seeing are the tiny little nerves from your nervous system that are being squeezed, sending a signal to your brain that you have pain. This is an important concept to understand. And I had a call earlier today, and on the call I was describing to the people who were working with one of my programs that the amount of space that we're talking about that is causing the pain is the width of an eyelash. And when our body squeezes, like if I squeeze my hand here, even just for a couple of moments, it creates a tension pattern that, if left unchecked, if I keep this tension pattern squeezed long enough, my hand's going to start to ache. It's going to start to give me problems. The same thing is going on with your knee. That the source of it is the nerves in your knee, something that really can't be seen on an X-ray, a CT scan, or an MRI. And the nervous system is how we experience our bodies. It's how we experience the world. And the nervous system takes this information in, and its command center is in the brain. So all of these little nerves that go throughout our entire body that give us the feeling and the sensation, when they don't have enough space, that causes the pain. So you can twist your knee, you can sprain your knee, you can smack your knee on a rock or whatever it is, and you'll go through the process, the medical channels, which I believe that everyone who's experiencing knee pain should do that first. Get a diagnosis from a doctor. Go to a really reputable, good orthopedic surgeon from a local collegiate or sport or professional sports team, and get their professional opinion. Get their diagnosis on what's going on with your knee, and make sure nothing is broken or torn. That way we have a solid foundation to move from. So, nothing is broken or torn, and your knee still hurts. We're in the right place. Listening to this Google Hangout, you're in the right place. Okay, the next piece we're going to look at is why this pain, if left unchecked, will lead to more problems down the road with your knees, and could even end up in a knee replacement surgery no matter what your age. And this is something that I see so many people suffering from. They think, well, if I rest long enough, then my knee will get better. If I just take a break, if I follow RICE therapy, which is rest, ice, compression, and elevation, my knee will eventually get better. Something will shift, something will change. The problem is sitting on your butt on the couch, waiting for your knee to get better, or going into physical therapy and pushing your knee through the pain does not get you any closer to being out of pain. One, you're exercising too early, and the other one is you're not moving enough. And the pattern of what we're talking about is within your nervous system, the hardwiring of your body, the electrical system that goes throughout your entire structure. And when this pattern is set in from pain, from tension, from discomfort, from an injury, from a car accident, whatever it is, this creates a pattern where your body doesn't feel safe enough to express itself, safe enough to move. And this pattern that if we're stopped, we're not necessarily feeling it, but when we're walking or moving, we begin to feel it. It's kind of like a car frame that got in an accident and the frame is bent. When the frame is bent, it's going to wear the tires in a certain way. And no matter how many new sets of tires we put on that car, the wear patterns in those tires are going to be the same. The same thing is going on with your body. It's going on with your knees. That if we don't address these patterns, the underlying patterns in the nervous system, by setting up the conditions so the body can heal yourself and creating comfort, we create the conditions so the knee joint is in pain, so the quality of your life just goes down the toilet. There's not a whole lot going on there. You can't be in a good mood if every time you step and you're concerned about your knees, you're thinking about your knees. And if you do move, what ends up happening is this pain causes the body to tense up more. This taxes your heart, your organs, your digestion is taxed as a result of this. All of the factors that go into play when the body goes into a fight or flight state are engaged when you experience chronic pain. And you leave this go for days or weeks or months or years. And what ends up happening is the joint squeezes tighter. The joint begins to wear. The joint hurts more. The body compensates to keep the body from experiencing the pain, so your tolerance level increases. And now the body hurts more. And the tolerance level increases. Eventually, you get to a point, like I was speaking to on the call, Tom on the call earlier today, where he's got arthritis in both knees. He's got a bone-on-bone situation. And he has ignored the pattern going on in his body for a long period of time. He's gone through all of that, the mentality in our society. Suck it up. No pain, no gain. Just do it. Pain is weakness leaving the body. All of these things about ignoring what's going on with our body and pushing through it, he's done. And what ends up happening is you end up with arthritis in bone-on-bone type of situation where now it's like, oh, the only way to get out of pain is through a knee replacement surgery. Cutting off the bones in your leg and replacing it with plastic and metal. Does not sound like a real favorable solution to me. Anyways, and on the other side of that, you still got to recover from the surgery. The patterns that were there before the knee replacement have not been addressed. So I actually have a friend in southern Indiana, a doctor nonetheless, double knee replacement surgery 5 years ago. And now she's already had one hip replaced, and she's going for the other hip to be replaced. And that's what ends up happening, because if you can't feel what's going on in the knees, the body has to compensate in another place. This is going to be in your hips, in your back, in your neck, in your shoulders, in your feet, in your ankles. And it just doesn't seem like a viable option to keep replacing all these different body parts. One, it's expensive as hell. And the other piece, is that how you really want to go through your life? Like the bionic person, the bionic man, the bionic woman, where everything is plastic and metal that are only rated for 10 to 15 years. And then they wear out. Or what if you get a recall before that? Now what are you looking at? So you have all these different situations and scenarios that need to be considered beforehand. And we can begin to address that now. That's what's great about the program that I work with. It's a natural solution. It's a holistic solution that looks at your entire body and sets up the conditions so your body can heal itself. So right there, you want to address this pain. We want to look at this pain. And not just pain for pain's sake, but pain with the knowledge and understanding, which leads us to the last point I want to cover today. How you can begin understanding the pain that you're feeling and use it to your advantage to eliminate your knee pain. If we look at pain from a normal perspective, most of society is looking to avoid the pain. We want to ignore the pain. We want to numb it. We want to do prescription drugs or pain-killing shots so we don't feel the pain. This is the concept with surgery, that we want to numb the pain. If we cut off the part that ails us, it'll make it all better. Well, in actuality, we're taking a part of our nervous system. Essentially, the dashboard in the car, when something goes wrong with the car, the dashboard light will light up and give us information. Well, I need to go to the mechanic and get a better understanding of what's going on, or I need to change my oil, or the battery needs to be replaced, or there's not enough coolant in the car. Well, what if we were to take that light that goes on and unplug it so we couldn't tell, and you just kept driving your car, and all of a sudden you're going down the road and the car just stops. We have no idea why, because we've taken away all of the data, all of the input that dashboard is there to give us. And this is what essentially we're doing when we numb the pain with drugs, shots, or surgery. We're not utilizing the information that our body is giving us in a constructive way. We're saying, I don't want to look at it. This isn't, I don't want to deal with it. I got better things to do. Which is fine for a period of time. If you have a screaming child or you need to get to work, but we have to zoom out and get a better perspective of what that pain is telling us. The other way we look at pain is it's like we suck it up, ignore it. Ignore it in a way where we push through it. And what ends up happening is we up the tolerance that the body has. If the knee hurts in the front, below the kneecap, your body will compensate. If it's my right knee and I want to compensate to protect my knee, I'm going to shift over to the left. Well, it's going to change how the pattern, how I'm walking in the right leg. It's also going to change what happens in the left leg. And something happens to my left knee now because I've been compensating. So then I shift back over to the right. Well, the right knee is already compensated, so I'm getting a different pattern in the right knee and the left knee. And this is what builds up over time. And when our body feels achy and old and creaky, people call that old age. It doesn't have to be the case. We can take this information from our nervous system. The clients that I work with, I teach them how to take this information from their nervous system. The people in the inner circle, I teach them how to take this information from their nervous system and utilize it in a way to go, oh, it hurts when I twist. I can stop for a moment, for a minute or two, sit down and work with my knee in a way so this pattern shifts, so my body can let go of the tension like that. Let go of the pain like that. And I'm not making this up. This is the reality of the program because we're working with the nervous system. We're working with the reflexes. Like when the doctor taps your knee with a hammer, your knee jumps. You cannot control that reflex. The same thing when the body is in a position of comfort. You cannot control the reflex that engages and lets go of the pain that your body is experiencing. The problem is we have to feel what's going on. We can't ignore it. We can't say the pain doesn't exist. We can't numb that pain with drugs or shots or surgery and utilize that same information to help our body heal itself. So this is how we have to transform our understanding of pain from pain equaling bad to pain being information. The information is valuable and useful to us in eliminating knee pain, in living the life that you want to live. So that is going to be the lesson for today. Neil, how are we doing on time?
We got plenty of time for some question answers, if you're ready to roll with that.
Okay. I know Dee had a very in-depth question on the Facebook page. I want to make sure we get to that first.
All right. I can read that one for you.
Yeah, go ahead.
All right. So this is from Dee. She's part of the Knees for Life Inner Circle, and she's posted this on the private Facebook group where the members can get support from each other and support from Bill. So her first question is, what's the best modules for tracking issues and patella tendonitis?
Mm-hmm.
Do you want to address them kind of one by one?
Yeah, let me answer them one by one. Otherwise, not only will I get confused, everybody that's listening will get confused.
Sounds good.
Okay. Patella tendonitis. Patella is the kneecap. Tendonitis is usually swelling or inflammation in the tendon that the kneecap is held in. D, I'm going to ask you to give me more details on exactly where it hurts, because patella tendonitis is just a diagnosis. The diagnosis is what a doctor would call it. When I'm working individually with clients, it's almost like a little kid, working with a little kid. You know, they get a boo-boo. My daughter's 15 months old, so it's like when she falls down and she has hurt herself, she points to be exactly where it hurts or when it hurts, meaning, are you stepping? Are you pushing off with the leg? Does it hurt when you're sitting down? And then where in the knee does it hurt? So with patella tendonitis, and I'm really guessing because I don't know where it hurts or when it hurts. So this is more of a guess based on the experience that I've had over the past 15 years of working with people. I would go into the virtual clinic. By the way, for those watching, these are the benefits of being part of the inner circle. When I answer the questions online here, what I will do is I will point to the members to the specific stretches that will help them most right now, the pain in their knee right now. So the first one that I would work with would be Module 8 with the kneecaps. Module 8A if the kneecap is locked. And Module 8B, this is going to be the patella pull. This is going to be working with the patella tendon below the kneecap. There'll be patterns where that patella tendon right down the center will hurt, and there'll be parts on either side that'll be sore as well. In working with the kneecap, the patella pull will help with that. So modules 8, 8A, and 8B, I would also take into consideration what's going on in the hips in terms of doing modules 20 and 22. 22 is going to address the tension pattern in the lower back, and 20 is going to address the tension patterns in the hips that consequently are tight, that will throw the pattern into that area right below the knee. And I would also do module 2, the difficulty with stairs. That would be what I would look at for that first part of that question.
All right. So question 2. What is the best modules for shin discomfort? As in the muscles in the lower leg feeling inflamed, in the same leg where the knee feels like it has patella tendonitis.
Yeah, those other modules will help relieve that. That's going down into the shin. And then the other piece I would work with would be, let's see. Module 29A, the shin bone squeeze, and the, let's see, module 42, the skin twist. And I know in the video I'm demonstrating on thigh, but that also applies, that you could work down the shin with that same with that same stretch.
All right. She has a question for this one. It's, can we regrow both types of cartilage in the knee, meniscus and articular, at the ends of the femur and tibia?
I believe so. Now, of course, when I say I believe so, we have to set up the conditions so the body is capable of doing it. I think there's a lot of factors that go into it. One is proper hydration. Of course, we talk about that in the program, making sure the body is properly hydrated because it needs the water to have the resources to be able to heal what's going on. The next piece is nutrition. This is key and probably can be supported with supplementation. The doctor, Neil, remind me his name, Greenville, South Carolina.
Charles.
Frank Charles, thank you. Dr. Charles has a supplement list. He's a naturopath that has put together an extensive list of supplements that would be extremely valuable to check out, that get into maximizing the body's production of stem cells and the resources it needs to heal. So, Neil, I'd like to put a link to that, the document with those supplements in the description of the video.
Absolutely. Cool.
So we'll get that in there so Dee could check that out as well. I just had a client check it out, and he said that, like, Dr. Charles just has an insane amount of supplements on his website, and I was like, and he's one of those brilliant guys that it's like, okay, you got to dumb it down even for me. But just to put, okay, you got a bone on bone. What do you need for bone on bone? And he, like, line by line, put all of the supplements that you would need. Torn meniscus, line by line, all of the things that you would need. Inflammation and pain, line by line, all the things you need. So that's going to be a very valuable document for anybody watching this video and getting access to those supplements.
Let's see. So actually, the rest of it, she's talking about how she is renting a IMRS PMF system.
That's a PMF machine. That's the one that Dr. Charles was talking about.
Mm-hmm. Do you want to speak a little bit more about that? I know we haven't talked about that in a while.
That is a brilliant, brilliant machine. It's a very expensive piece of machinery, and the technology on that is absolutely brilliant. And basically, it creates an electrical field around the knee, or actually in the body. And when we have an injury, we have pain. Wait, let me back up just for a moment. You have the body being an electrical system. The nervous system is an electrical system. So it gives off a frequency. And every part of the body gives off a different frequency. And when there's an injury that takes place in the body, scientists can measure the frequency of that part of the body will drop because it's essentially dying. And what the PEMF machine does is it creates a field, especially around the area that is having the problems. And when you create that field around the area that's having the problems, it brings the vibration of that area of the body up to a place where now the body is capable of healing itself. It's kind of using the technology that's out there in a way to our advantage. And not so much technology as far as surgery, but technology as far as, like, there's some really cool stuff around energy and frequency and vibration that scientists they're proving. This is not like woo-woo out there stuff. This is like concrete things that they've done double-blind studies on knee joints, and the cartilage and the meniscus are regrowing itself. So it goes back to the original piece that Dee was talking about, that the cartilage and meniscus can regrow.
That's great, and I know that we have been talking about putting that link up to have it available to learn more about that, and we'll get that up on the website. And if you need to learn any more, please feel free to email customer service at kneepainguru.com. We can get you more information about that.
Well, I think we covered Dee's question. The other stuff she was just sharing about her experience, I'd like to talk to her about her experience with the PEMF machine when she has been working with it for a bit.
Yeah, we'll get her on one of the Hangouts.
Yeah,
all about it. So this question is actually from Kate Douglas, and I'll just dive into the question. Hey, Bill, I just purchased the Comfort Zone and have not yet begun to apply them, but reading through, I noticed that some of the positions to begin the stretches are in a 90-degree sitting position, to which I cannot bend my knee quite 90 degrees yet. Medical meniscus reconstruction and ACL reconstruction 6 weeks post-op. I am told I am behind in my recovery process, as I should be bending past 90 degrees by now. So my question is, will these 11 stretches still help me to get where I need to be, or is there other books I can purchase or coaching sessions which can give me different stretches? It is assumed I have some scar tissue that needs to be broken up, but obviously it is painful, and it is assumed my physical therapist is not being rough enough with me, but I was hoping to find a less painful way.
Okay.
I am only given 11 more days to make a traumatic turnaround and then see the doctor again. If you could point me in the right direction, I would greatly appreciate it.
Okay. Yeah, that's a frequent story that I hear. I think it's this physical therapist not being rough enough. I think of like this medieval torture chamber. Somebody running around with a whip, that'll get her knee to bend faster, but maybe not so much. Okay, here's the deal. Yes, work with the comfort zone. You can work with the knee in a position of comfort. It doesn't have to be bent 90 degrees. That is some of the more common positions we work in. There's two directions I'd point her to. One is work with me individually, especially if she has 11 days. That's kind of like, what are you going to do? You got to make things happen, although I have gotten some really phenomenal results in a short period of time, especially with Drew, with the cartilage. He had arthroscopy in June. We got him full knee flexion. I think I showed that a couple hangouts back or something like that. So it is doable in a short period of time. I don't believe scar tissue prevents the knee from flexing. I believe it's the tension in the joint, also the tension in the hip. I don't believe, I believe the flexion of the knee will come as a result of relaxing the tension in the knee, relaxing the tension in the hip and the lower back. Physical therapy being more abusive to the body does not necessarily get the body where it wants to go or where it needs to go. So, and the interesting part is they'll say, well, and they do this with frozen shoulders too, that will put you under anesthesia, and then we'll break up that scar tissue. Now, granted, scar tissue plays a role, but I don't believe it plays as great of a role as what the doctors and physical therapists are claiming it to be. Because what is giving the signal? What is controlling the ability of the knee to bend, the hip to flex, or the arm to move? It's your nervous system. It's got to get a signal. And if the body doesn't feel safe, it's not going anywhere. And your physical therapist could beat the absolute crap out of you, and it's still not going to move more because the body is still feeling unsafe. And a matter of fact, after they get done pushing the body that way, it's probably going to be less safe, feel less safe, and it's going to move less. So I don't think, especially with the trend for knee surgeries and knee replacement surgeries, I don't think their model is really working. Something to consider. So I'd say get on the website, set up a time, go to the products page, go to the knee recovery program at the bottom of the products page, sign up for a 30-minute time to speak with me, and we'll get a time to talk about your options and really get into how we can help you. Because the ACL thing, that's what I did. That's a bugger.
Good, and I'll actually post a link for the video with Drew that you were talking about too, just so people can just quickly reference that one too.
Cool, excellent.
So here's one. Hello, knee pain guru. I fell off my bike almost 2.5 months ago, and my knee is still swollen. Mm-hmm. I had no fracture, but my doctor says I might have hurt delicate muscles. Mm-hmm. I can feel the fluid above my knee and a little bit below my knee. Is it normal that it's still swollen after 2.5 months after the injury? I have pain too when I stand for a long time, and my knee gets locked and I feel hesitant to bend it.
Mm-hmm. Is it normal? Well, I mean, that's what you're dealing with. Whether it's normal or not doesn't really apply. We got to take what we're dealing with today and move forward. And this was something actually I was dealing with on the call earlier. It's the lymphatic system. When you have chronic inflammation in a joint like the knee, it means the lymphatic system is plugged up. The lymphatic system, meaning they're like the garbage collectors. They clean out all of the dead cells and they move things out of your body. And when we have this tension pattern, because the body has protected itself from the injury, doesn't feel safe, it holds on to this pattern in a way that clogs the lymph nodes from draining. So it creates a situation of chronic inflammation. In addition to the tension pattern that's going on in the knee, that every time you bend it or you have that hesitation, it's irritating the nerves. So then it causes, inflammation in a different way, kind of like acute inflammation. Like if you were, if you took your knuckles and just kept rubbing it across your cheek all day long, your cheek's going to get sore. It's the same thing in the knee. If I keep bending my knee and it's holding a pattern, like my knuckles being up against my cheek, that's not a normal pattern. Like the bones being pressed together is not a normal pattern, and what ends up happening is it irritates and doesn't allow the lymph to clean itself out. One more thing. The lymphatic system does not have a pump of its own, meaning like the heart pumps the blood, the lungs pump the oxygen. But the lymphatic system, what cleans your body out, does not have a pump of its own. It's required movement to clean itself out. And when we have tension in the knee and the pelvis and the lower back, because the body's protecting the knee, we stop that movement in the pelvis, the pump of the lymphatic system, is so we get like a kink in the garden hose. I refer to it as like a kink in the garden hose, so the body can't flush itself out. And that just creates a state of chronic inflammation, swelling, issues that are going on that doesn't allow the body to heal on its own.
Okay. We'll do another question real quick. My problem is not the knee, but below toward the calf muscle. My doctor said it looks like the IT band. Sometimes it seems to get very knotty and like a gnawing type of pain. I had it for over 1.5 weeks already. I've iced it, heated it, compressed it, put on a deep rub, but it still lingers. I've noticed that the IT band is common with runners, but I am not a runner. What would you recommend?
What would I recommend? Creating comfort in the spot, taking the tension off of how it is, the pain, the knotty feeling, the tension in the IT band. It doesn't matter if you're a runner or not. IT bands hurt on people, that sit on the couch and don't do anything. So what we could do is, all we got to do is create comfort. Begin creating comfort in the body, simultaneously setting up the conditions so the body can heal itself, and things will begin to shift and change. And you see what happens. Because right now, when we have an injury, the general level of tension in the body is like real high. And if we create pain from this place, it's just going to amp up. It's like like you're at a rock concert and you got to scream loud enough so the person next to you can hear you because you're trying to scream over the blaring music at the rock concert. It's hard. You could do it, but it's really hard. How much easier would it be to whisper to the person next to you at that same rock concert if they shut off the rock music? It'd be easy because you don't have to compete with the loud noise at the rock concert. It's the same thing in the body. If the body's at this high level of pain, has this high level of discomfort, whatever happened, you smacked your knee falling off your bike, or you got into a car accident, and both of your knees hit the dashboard, or you twisted your knee playing football or soccer or whatever it is. You have this high level of pain. The way to begin to hear what's going on in the body is beginning to create comfort in reducing that pain. Then you can see what's going on. Then you can address it. Then you're taking the information from your nervous system and utilizing it in a way that brings wisdom and understanding to what's going on in your body. Is that, that's got to be helpful. That's got to be better than what he's doing right now. Oh.
I think so. Let's see. Let's do another question. You want to do another question real quick?
Sure. I want what I like from people is to start including your age, so we know like how old you are. Because there's people all over the board. I look at the list of names that I had earlier today, and it was Tom and Andrea and Jamie. But they were ranging in age from like 66 down to late 20s. So knee pain strikes quite a wide range of people.
Good to know, and we'll remind our inner circle members about that too.
Yeah.
Let's see. Here's one. Bill, I sprained my knee 3 times in 4 months. I did an MRI, and it appears that I have torn meniscus. I stopped playing soccer for several months. I did physical therapy, and it helped, but if I run or take shots, it hurts. What should I do? I want to get back to soccer.
Yeah, that's the there's this gap I see in physical therapy. I know we did an entire Google Hangout on this a while back. But you have this one mentality where you do like RICE therapy, rest, ice, compression, and elevation. Basically, you're sitting on your ass, not doing anything. You're just there. And then you have this other thing where we got to push the body. And there's this huge gap between there where there's no knowledge. It's like a blind spot in our awareness. In the medical model, in physical therapy, in most modalities, even alternative therapies, there's this huge gap between sitting on your butt and not doing anything and getting out there and exercising. And that's where we need to look at setting up the conditions so the body can heal itself and creating comfort. And that moves the person from the couch to begin movement and start acting and interacting with their world and in their life, and eventually ramp up to a place where they could begin to exercise, where they could begin to walk and run and do all sorts of things without pain. And this is exactly what I'm doing with Drew right now, is we're at a place, I think we're like 3 months in-ish, something like that. And we're systematically going through his body, reducing the level of pain and increasing the level of activity. And when the pain starts to go back up, he uses the passive stretches or the comfort to begin to bring the pain level back down so he can continue his upward swing in terms of mobility and activity. So his goal is to play basketball. Like, he couldn't even comprehend playing basketball when he first started. So that's the system. And it works if you follow it. If you don't follow it, and you try to push the body too soon, what ends up happening is you bounce the body back to the place where you got to sit on the couch again. And that's what people, they ping pong back and forth from sitting on the couch not doing anything to, oh, I'm pushed the knee and I did too much and now I'm back sitting on the couch again. And you stay that way for weeks and months and years to a place where, like I said, you're on that slippery slope to a knee replacement surgery.
Great. So I wanted to, with the pending holiday tomorrow, I wanted to talk, for our Inner Circle members, I wanted to talk to them, and I wanted you to talk about, those traditional Thanksgiving meals that are just primed for inflammation-filled like foods, and talk about the different foods that are in there that they may want to steer from a little bit, or maybe, recipe tweaks that they can have.
Yeah, I would just eat turkey, ham, and vegetables. That would be my answer. I mean, like, the easy answer is turkey, ham, and vegetables. And vegetables that really don't have anything else on it. I like the cranberry sauce too, and I don't care if there's a little bit of sugar in it. But no, I mean, I'm okay with that. But the big thing is there's a lot of wheat that they put on. The green beans are fine, but then they put all the other, the green bean casserole where they got a layer of onion rings that are coated in bread and a lot of the dairy on it and stuff like that. That just wrecks you. You feel horrible. I mean, it wrecks me. And there's this experience that people have after eating a Thanksgiving meal, and of course there's the whole tryptophan thing in the turkey that will make you tired, but a lot of times the fatigue that you're feeling is a result of the other foods, a lot of the sugar, a lot of the wheat, things in there that just the body doesn't know what to do with, and you feel tired and sluggish. And like right now, I mean, I'm not so much the recipe guy. However, what I can say is, like I said, I would just focus on the turkey, the ham, and the vegetables. Have a little bit of cranberry sauce. That would be the way I'd go. I'd stay away from the bread. I'd stay away from all those other things that, you could. I've been working actually with clients this way. It's like, think in your mind how that food is going to feel after you eat it. Just visualize it. Like, if I look at that thing of sweet potatoes with all of the marshmallows on top of it, and damn, it's going to taste good, but after I eat it, how am I going to feel? Try it. Try it out. And 99 times out of 100, you're going to be right. You're going to be absolutely right. And this is part of tapping into the wisdom and knowledge and understanding and intuition that your body has that we ignore. How it feels, which is how we got into knee pain to begin with, because we ignored things. I was no different. Dislocated my knee 4 times, left knee 4 times, then went to the doctor. Is there anything wrong? It's torn. Oh, I'm so surprised. How did that happen? So So, you know, we teach what we need to learn most. That's why I'm on this end of the camera right now.
So that's the big ones, right? That we got the sugar.
Yeah.
We got the wheat. So, and the wheat that hides, like the stuffings.
Yeah.
All that you forget is in there. What else? What else is going to cause inflammation?
Well, stress. Stress causes inflammation. Just being around people you may not want to be around, or traveling, or in traffic and things like that, the stress level goes high. You know, Neil, I think what would be really good is, I mean, it is the day before Thanksgiving. It's going to be real hard to change like a big pattern here. However, I can tell you the day after Thanksgiving what you could begin doing immediately to recover faster after it. And that is, you know, I had a friend of mine who was a doctor, and she said the solution for pollution is dilution. So what that means is, if we're eating foods that make us not feel so good, the best solution for it is to drink a lot of water afterwards. And that dilutes the pollution of the food we just ate. And what ends up happening is it gives our body a better chance to feel better quicker. I would also, and this is something that Dr. Frank Charles has in that document that we're going to attach below the description of the video, is around eliminating the inflammation through the supplementation of fish oil. That's something that I use on a daily basis. Whenever I go traveling, or I can't eat as well as I would like, or I just kind of feel like my belly kind of feels swollen and doesn't feel so great, I will have fish oil like 3 times a day. Not a whole lot, but just fish oil 3 times a day. And Dr. Charles has this one that's just phenomenal. The way they process it, it doesn't taste fishy. There is something, he would be able to explain all of that, but it's the way they process it that keeps it from being fishy. So I would supplement, you know, Thursday night and beginning Friday with fish oil at that point.
How about the big one, the table salt? Every table's got it for Thanksgiving. Every dish is full of it. Talk about the difference between table salt and sea salt.
Oh, it's like apples and oranges. Very different. Table salt is really, there's no nutritional value in it whatsoever. Even though they add iodine to it, it's kind of worthless as far as I'm concerned. I don't use it. If I can avoid it, I don't use it at all. The type of salt that I use is called Selena Naturally sea salt. It's actually an Asheville company. Hold on a second, I'll show you a package of it. I got a package of it right over here. Let me show you. So this is live, it's not staged. Okay, Celtic sea salt. You could find this, they have it at the local grocery stores here in the Asheville area. I know the owner of the company, Selena. She's phenomenal person. She's done extensive research, unbelievable research, like binders. I've heard her do a presentation here in the Asheville area. Binders of research comparing like Celtic sea salt with regular table salt, with other types of sea salt, with Himalayan pink salt, like all these different types of salts. And she found that her salt has the highest level of minerals in the salt. And the reason why they found that this salt has the highest quality is because of the amount of water, because the salt is wet. It's kind of like in your hands, you could feel it. It's kind of damp. It's gray. It's coarse. And what that means is the amount of nutritional value is contained in the hydration of the salt, not in the actual salt itself. So the fact that her salt, the salt that her company processes and delivers is still wet is the high quality salt that's in there. I'd love to get her on one of these calls and interview her and let her explain, because she'll do such a better explanation than I can on it. But I would highly recommend that, using that type of salt all the time, all year round.
Great. And for the people that aren't used to using that type of salt, you can absolutely put that in a grinder, a pepper mill grinder, and get it down to kind of the small size that you're used to with table salt.
Yeah, it tastes so good too. Like the salt is just amazing. And it really helps with rehydrating the body. Times when we can't drink water, the body is nutritionally deficient of minerals, and it can't absorb the water because it needs the salt to transfer the water from outside of the cell to inside of the cell. And if we don't have that, those minerals in our body, the body shuts off the mechanism to be able to drink water. That's why a lot of people I say, okay, we got to increase water intake, and they're like, Bill, I got to run to the bathroom all the time. Well, that's because we don't have enough minerals. So we start increasing it with high quality salt, like Celtic sea salt. Then it's very beneficial.
Okay, I think they got enough to arm themselves to go into Turkey Day.
Yeah.
Some wise choices. One thing that I wanted you to talk about, and I know that we talk a lot on these Hangouts about your program, right? About your programs and these virtual clinics and the things available for people to work with you. One thing I wanted to spotlight today is the comfort zone. Your set that is the best kind of introduction. But I mean, I guess you can go ahead and explain that.
Well, I have a package that we'll put the link below the video. It's a combination of the comfort zone, which is like an introduction to my program about creating comfort in your knees, as well as my Knees for Life book, which is the overview, the strategy of my program and how you can set up the conditions in your life and in your body to heal your knees. So I have a combo package of that, the Comfort Zone and the Knees for Life book, as well as if you sign up with that link, you'll get access to be able to set up a time to speak with me about your specific knee situations. So I think it's a great, if you're looking at this, you're going, hey, Bill's got some good information, but I don't know anything about his program. This would be a real good introductory step for you. There's also if you're in this place where you're going, gosh, the information is really awesome, there are other products and programs that we could talk about on your call, or on the call that we have together. So that would be, I think, the next step for someone listening to this and going, this is good information. I could really benefit from this. So we'll include that link in the description below.
Yes, absolutely. Well, I feel like the questions have stopped rolling in, and we've got a lot of great information for everybody, and it's right on time, 3 o'clock
Yes.
Eastern time. So if you want to give us those last-minute words of wisdom from you and sign us out.
Yeah, absolutely. Happy Thanksgiving, everyone. Thank you so much for being on the call. There's a lot of great information out there. I believe that this is a unique approach to eliminating knee pain. I have this dream of making knee replacement surgery obsolete in my lifetime. I don't believe anyone needs to go through a knee replacement surgery if they implement the steps in my program. So I'd like to share that with you. If you know someone that is looking at a knee replacement surgery or has been in knee pain for a long period of time, send them this video. forward this video to them and say, watch this, sit down with them, hold their hand. And you know, just to show them that there's other information out there. And then if something isn't working, it's not because that it doesn't work, it's, you know, maybe there's something they haven't tried. There's a lot of information out there. There's you know, over 7 billion people on the planet, and there's a lot of great information that's being discovered, new and old, and I believe if we put it in the correct order, in the right combination, you can be out of knee pain in a relatively short period of time. It'll make your head spin, which is really cool. So, thank you so much for being on the call. Our next call is going to be when?
I believe it's the 11th. Let me make sure. December
11th at 2 p.m. Eastern Time. So we will do the next Google Hangout then.
Thank you, Bill.
Thank you, Neil. Thanks, everyone, and have a happy Thanksgiving.